Breathe in. Hold your breath.
During the height of the pandemic, a lot of centers and non-invasive imaging tests were shut down because of the potential risk of contracting COVID. Cardiac CT, we thought, was the least risky. It's fast, it does not require a lot of preparation, and it's non-invasive. The shorter the time that we interact with the patient, the less risk both for the patient and the practitioner. I kept the technology open thanks to the staff here at Lenox Health Greenwich Village. And we did over 140 patients with suspected COVID. So I came up with a strategy to combine the traditional use of CCTA, looking at the heart, and now we can open up the field of view a little bit and can also screen for the lung problem at the same time. This is the lung, and you can see whether there's COVID involvement. We pick up a bunch of patients with acute coronary syndrome who need to go to cath lab immediately for intervention. The time factor becomes very critical. When a patient in the emergency room presented with shortness of breath, you really want to get a diagnosis as quickly as possible. And CCTA, as I said, only take fraction of a second to get the image.
Less than 10 minutes?
It feels so easy.
You don't even have time to get claustrophobic. I started the CCTA program several years ago, and during COVID, it was really very useful because of the setup. We have both technology in the emergency room and also on the 5th floor, outpatient imaging center. They can come up without the fear of going into the hospital and contracting COVID. There's really no better imaging technology, non-invasive or invasive, to quickly screen the patient. And when someone come in with chest pain and shortness of breath, that many things could go wrong. Now you have one single test that can point you to the right direction.